Pope Francis remains in hospital after he was admitted with a respiratory infection. The Vatican has confirmed his condition is improving as treatment continues.
Just days before the start of Holy Week, Pope Francis is receiving treatment in the hospital for a respiratory infection. The Vatican says he was, quote, progressively improving overnight. On Thursday, the 86-year-old Pontiff thanked his supporters, tweeting, quote, I am touched by the many messages received in these hours, and I express my gratitude for the closeness and prayer.
I wish that the Pope, who was so fundamental for our Church in this moment, gets out of the hospital as soon as possible.
The Vatican announced on Wednesday that Pope Francis had gone for pre-scheduled tests before saying he was taken to the hospital after suffering breathing problems. Doctors ruled out COVID and stressed that there was no cause for concern.
Historically, he's not had tremendous health difficulties. When he was a young man in his early 20s, he had a portion of his lobe of his lungs removed. But he said that that's never caused him any trouble since then.
Before being admitted to the hospital, Pope Francis greeted a crowd of people at St. Peter's Basilica, as he does each Wednesday. He was scheduled to celebrate Palm Sunday Mass this weekend, but it's not clear how his condition will impact his ability to do that. On Wednesday, President Biden urged people to pray for the Pontiff.
I found that the two most Christ-like figures I've ever met were His All Holiness and the Pope. The Pope is ill now, so say an extra prayer for him.
Vatican officials have already said that the Pope's audiences, at least through Friday, will be canceled.